Hi everyone, today I am going to discuss the main neurotransmitter of psychiatry, dopamine. Dopamine is a catecholamine. Dopamine is a catecholamine which is synthesized from L-tyrosine. From L-tyrosine. L-tyrosine is converted into L-dopa. Then L-dopa is converted into dopamine. Then dopamine is going to be converted in norepinephrine to epinephrine. Okay, here from L-tyrosine to L-dopa, the enzyme tyrosine hydroxylase come into play. From L-dopa to dopamine, this is dopa decarboxylase, which is rate limiting enzyme in this process. Now after dopamine is synthesized, it goes into the presynaptic vesicle, stored or goes into presynaptic vesicle. Why? VMAT means vesicular monoamine transporter. Vesicular monoamine transporter. This is presynaptic vesicle. This is synaptic cleft. This is presynapse, postsynapse. This is synaptic cleft. Here this is VMAT. Dopamine goes to vesicles with the help of this. Here in the presynapse, in this vesicle, there are two enzymes, MAO A and MAO B. In the presynapse vesicle, these destroy dopamine in presynapse. Okay, MAO A and MAO B destroy dopamine in presynapse or presynapse, free dopamine in presynapse. Okay, if this is the vesicle, here dopamine is released. Now when dopamine goes from synaptic cleft to presynapse, there is another transport required. This is DAT, DAT. Okay, till now we have studied VMAT, dopamine to vesicles, second is MAO A and B, destroy extra dopamine in pre-synapse. Third is DAT, synaptic cleft to pre-synapse transport of dopamine. Okay, now here there is another enzyme present in the synaptic cleft. What is this? This is COMT. What is this? This is catechol O methyl transferase. What is this? This destroy the dopamine in synaptic cleft. This is present in synapse. Let's revise this once again. In synapse dopamine, VMAT, synaptic cleft to dopamine in presynapse, DAT, destruction required two enzymes, MAO A and MAO B, COMT A, COMT in synaptic cleft. Okay, on post synapse, there are mainly 5 type of receptor: D1, D2, D3, D4 and D5. Okay, dopamine have mainly 5 type of receptor: D1, D2, D3, D4 and D5. D1 is present in frontal cortex, and limbic cortex. D2 is maximally present in striatum and extrastriatal area, mainly in presynaptic, act as an autoreceptor. D3 mainly present in hypothalamus, but in less amount in striatum. D4 mainly in midbrain area. D5 mainly in limbic area. Okay, remember the dopamine receptor. Next, I am going to discuss the dopamine pathway. The key dopamine pathway. First pathway is mesolimbic pathway. The mesolimbic pathway is basically involved in psychotic symptoms, rewards, and motivation. Okay, it is from ventral tegmental area to nucleus accumbens. Okay, this is dopamine. Ventral tegmental area to nucleus accumbens. The pathway is from ventral tegmental area to nucleus accumbens. And this pathway controls emotion, motivation, rewards, pleasure, and positive symptoms of psychosis. Okay, this is the first pathway. Next, the second pathway. Second pathway is mesocortical pathway. First was mesolimbic and second is mesocortical pathway. The mesocortical pathway is from ventral tegmental area to dorsolateral prefrontal cortex and ventromedial prefrontal cortex. This is for cognition. This is for emotion or mainly affect. Okay, and hypofunction hypofunctioning of this pathway will lead to negative symptoms. Okay, means decrease in dopamine in this pathway will lead to negative symptoms. First was mesolimbic pathway for positive symptoms, and second is mesocortical or the hypofunctioning of this pathway will lead to negative symptoms. Next, third pathway. Third pathway is nigrostriatal pathway. From substantia nigra to basal ganglia. Means stratum. This is nigrostriatal pathway. The hyperfunctioning of this pathway, there can be hyperfunctioning, there can be hypofunctioning of this pathway, or there can be chronic blockage of D2 receptor in this pathway. In hyperfunctioning, it can lead to movement disorder. What are these movement disorder? These can be chorea, athetosis, tics, and dyskinesia. These are the hyperkinetic movement disorder. Chorea, atetosis, tics, or dyskinesia. The hypofunctioning of this pathway can lead to bradykinesia, rigidity, or tremors. The drug-induced Parkinsonism is due to the hypofunctioning of the nigrostriatal pathway due to dopamine blockage in this pathway. Okay, these are the symptoms of drug-induced Parkinsonism. Chronic D2 blockage receptor in this pathway will lead to tardive dyskinesia. Chronic blockage of D2 receptor in this pathway will lead to tardive dyskinesia. Due to the chronic D2 blockage, in this pathway will lead to chronic D2 blockage in this pathway will lead to upregulation of T2 receptor. Happen, and this will result in supersensitivity, and this will lead to TD or tardive dyskinesia. Okay, next, the initial tardive dyskinesia is reversible by stopping antipsychotic, but the chronic use or the chronic blockage of D2 receptor in this pathway or the nigrostriatal pathway, this is irreversible TD. Initial tardive dyskinesia is reversible, chronic blockage is irreversible. Mark this point, these are the star point. Next, the fourth pathway. This fourth pathway is tubulo-infundibular pathway. Tubulo-infundibular pathway is from hypothalamus to anterior pituitary. From hypothalamus to the anterior pituitary. We all know that here dopamine inhibited prolactin release in this pathway. This is the mechanism of action of this pathway. The dopamine inhibited prolactin release. If D2 receptor blocker or the antipsychotic has been used, then there will be increase in prolactin release. And the increase in prolactin release will be responsible for amenorrhea, decreased libido, gynecomastia, and sexual dysfunction. Okay, hypothalamus to anterior pituitary. This is a mechanism of action of this pathway. Dopamine inhibited prolactin release. Dopamine receptor blockage in this pathway by antipsychotic will lead to increase in prolactin level, which will in further lead to amenorrhea, decreased libido, gynecomastia, and decreased sexual desire or dysfunction. This is the fourth pathway of dopamine. The fifth pathway is thalamic dopamine pathway, or the dopamine pathway involving some thalamic nuclei. Okay, this is from this pathway is less studied. Periaqueductal area, ventral mesoencephalon or hypothalamus to thalamus. Okay, this pathway is involved in sleep and arousal mechanism. Okay, this is my first video for the first year resident. The next neurotransmitter for my lecture on YouTube will be glutamate. Please subscribe my channel. Thanks. This is Dr. Nitin Parekh. Thank you.